mean, I always just tell people to just imagine basically the worst. Like when you think of an addict, when you think of that, like just the worst addict, I just tell them to imagine, you know, like dealing with homelessness, you know, illegal activities that went against my values and that went against, you know, like who I am today. I used to say, oh, I'm just gonna die with a needle in my arm. And I was like, there was a point in my life where I was like, okay with that. I had accepted that. And to think about it and like how I could crawl out of that hole until like I'm sitting here now talking about like my recovery is just crazy. It's black and white.
The thing that stood out to me the most with Ericka is her willingness to look at other people's perspectives and try to apply those to her life, whether that's her mental health provider, whether that's me as her substance use provider, or people in her support groups. Her willingness to look at how she can make changes in her life to improve it.
They're just really there to help you in every way. And Amber, mental health, like that is such an important piece that not a lot of places have. And I think it's necessary. When you're in addiction, you deal with a lot of stuff. And it's important to be able to talk about that with somebody you trust. And that's huge for me, is that I'm able to trust.
Well, I think MAT and mental health complement each other really well. MAT provides the stability so our clients don't have to battle their physical dependence and their withdrawal symptoms, so they can start to address the deeper issues. And having mental health available to start working on those things, as soon as a client gets to that point of physical stability, it really creates a lot more success and movement and treatment for our clients.
Yeah, like they do deal with kind of different things, but it ties together. Both of like this chemical dependency side and the mental health, they kind of mesh in with each other, and they both just do an amazing job. I wouldn't want anybody else on, you know, I'm just very supportive of THS. Now I get up, I get my daughter, you know, ready. I walk my dogs every day. I help my daughter with her homework. I do my homework, and I get to start my bachelor's program in human services. And hopefully one day I'll go on and get my master's, and I'll be able to help people like Richard and Amber, because that's what I want to do. It's much easier than just going cold turkey, but not only that, is they get you on the right dose, and then they are able to integrate you into mental health treatment, so that's, you know, picking up some of that downtime that you had where you might use or something. Like now you're getting mental health treatment along with it. They always say like, you know, oh, well, you did it, you know, and I know I did, but I really feel like they helped me so much more. I feel like I couldn't have done a lot without them. I feel like they really gave me a lot of encouragement. So I'm thankful for THS just as an organization that there is something to help addicts, you know, like there is another option than just continuing to use or whatever. And I'm thankful for my family that they never gave up on me, that they're still there, and they always believed I could do it too. So I just am grateful for a lot today.